Ebenezer. I'm a consultant physician in Madurai, and I have about more than 10 years of experience in the field of diabetology, hypertension management, which are my primary interests. So today, the topic we're going to discuss about is management of hypertension. And defining hypertension, we would classify hypertension as anybody having a blood pressure of more than 140 systolic and 90 diastolic. It's favorable to keep the blood pressure below that to avoid organ damage, especially to the eyes, the kidney, the brain, and the heart. Uh, and any blood pressure which is more than that would progressively over a period of time affect these main organs. And any BP which is even higher, which is known as hypertensive emergency or urgency, that is any BP of more than 180 systolic would immediately have an adverse effect on the heart and the brain. So in that case, it's favorable to bring the blood pressure to a near normal range, even earlier or even faster within a span of 24 hours. So coming to management of hypertension, some of the important lifestyle modification that one needs to follow is salt restriction to keep the salt in diet as low as possible, less than 2.4 grams per day. Also, it's important to avoid foods that are being prepared with salt or that are in excess of salt, like preserved food, biscuits, chips. Also, best to avoid papad, dry fish. So these are things that are very high in salt, and any preserved food, that is anything that is bought from a bakery, would have high salt, and anything like biscuits and chips over the counter in a grocery shop is bound to have high salt. So it's best to avoid these types of foods. And second important thing that I always tell my patient is to walk every day and make sure they sweat a bit so that all the excess salt comes out through the sweat, and that is another way of actually eliminating salt from the body, and that is time and again shown to keep your BP under control. And third most important step is obviously consult with your doctor monthly or twice, once in 2 months. Take medications on time. Make sure you monitor your blood pressure regularly, including and if preferably have a BP monitoring done at home at least twice or thrice a week, if not every day. So it's good to have a sphygmomanometer at home, a BP apparatus at home. And now with the advent of automatic BP apparatus, it's become easier to actually monitor blood pressure from home itself. And this would actually be a better indicator or a better reflector of what the actual BP is than checking the BP just once in a doctor's chamber, because there's something known as white coat hypertension, where when you come to the doctor's chamber, you feel stressed or you feel anxious just by being there, and because of that, the blood pressure shoots up, and so you might be judged wrongly, or you might be given a little higher dose than what you need to take. So it's always good to have ambulatory BP recordings, if possible, with the BP apparatus at home. Even otherwise, there are multiple doctors' chambers, including ours, where we have BP apparatus which we give to patients, or we have ambulatory BP which we connect to the patient, and over the span of next 24 hours, it keeps on checking the blood pressure. And so we'll have a reading, or we'll know about the parameters, BP parameters over the span of 24 hours. So that is one important thing. The next important thing that we should be following at home is obviously what I usually tell my patients is that as much as possible, reduce stress. So it's not easy in everyone's life to bring down stress, but stress at least temporarily will shoot up your blood pressure. And the harm with stress and that sudden shooting up of blood pressure is already in somebody who has already decompensated heart, is that sudden strain on the heart can precipitate a myocardial infarction. So they might have chest pain, or it might even predispose to a CNS bleed or a bleeding in the brain. So it's best to avoid stress, balance work and general life, uh, meditate, practice meditation, and also to have good amount of diversion. So you shouldn't be a type A personality who is forever stressed at home, stressed at work, and stressed even in your sleep so that you don't have a sound sleep. So that will actually increase the risk of stroke and heart attack. So these are the steps that each and every one of us should follow to one, identify hypertension, two, to manage hypertension at home, and three, obviously should consult with a physician so that your hypertension is managed well. Thank you.